It is 1:03 and I would like to call the meeting to order, recognizing that we have quorum. We also have a few folks that are virtual. Jack and Stephen are virtual, and Joe from the media, correct?
Correct.
So I will do my very best to check the screen on a regular basis, but if any of my friends around the table see someone with a question, don't hesitate to point me in that direction. So calling the meeting to order, recognizing we have quorum, and I would, are there any other guests that we need to introduce?
No,
good.
other than we have staff along the side just because of the table space, but you know.
All familiar faces, some of them tan.
Some of them.
I was away, it's not tanning.
Next item is approval of the agenda. The resolution is that the agenda for Southwestern Public Health Board of Health meeting for today, Thursday, November 28th, right? Yeah, 24th here, be approved. A mover, I have Marcus, seconder, David Warden. Any discussion? I'll call the vote. All those in favor? Any opposed? That motion is carried. Thank you. Next item, a reminder to disclose any pecuniary interest. Are there any that need to be disclosed at this moment? If not, as the item arises on the agenda or any previous meeting that the member was not in attendance for, please declare. A reminder that our meetings are recorded for minute-taking purposes, and the open session portions are now publicly available for viewing for 30 days after being posted on the Southwestern Public Health website and YouTube, for those who want to go looking for those. Item 2.1 now, approval of the minutes. The resolution is that the minutes from Southwestern Public Health Board of Health held October 24th, 2024 be approved. A mover, Jim, seconder, Mark Peterson. Any discussion? Seeing none, I'll call the vote. All those in favor? Any opposed? That motion is carried. Thank you. I appreciate those of you who are virtual, the way you're putting your hand right up in front. That's very helpful. And now we move to item 5.1. Acting Director, Medical Officer of Health, report for November 28th.
All right.
Joyce,
You're up.
Dr. Law.
Okay, got me up fast here. Let me
Zippy, zippy.
All right. Okay. Business. Here, I got it. Okay. Sorry about being slow here.
No, it's 13 or 12.
So, most of my report was self-explanatory. I tried to, the first section is on collaboration, engagement, coordination. It was, my objective there was just to share with the board members how the medical officer of health interacts with other groups in the province who are all part of public health, and how through those channels the work of public health across the province can get coordinated, and how we can be in step with at our health unit with what the goals and objectives are across the province. So in a way, we're never really alone in what we're doing. The medical officers do try and collaborate in a way to be a stronger force in moving population health forward. They also consult with one another to try and have a unified face of public health in what we do, with what as well in the same time as trying to address, local variations. So the North, for example, always has a much stronger concern about Indigenous issues because they have so many of them up there. And of course, our urban centers will have their own special focus. So that's that section on there. That was for your information. And I'm happy to take questions about any of that later on. And so in 1.2, there was on the regional engagement. So we have been working with two of our Ontario health teams, the Elgin health team, Ontario health team, and the Oxford one. Our The nice thing about those two teams is that they are maturing nicely. Both of them now have hired staff and a budget, which makes having a face and a name to liaison with much easier. So the challenge now I'm finding from the public health perspective is that to some degree, we work on different ends of a spectrum. So public health works with the population in general, trying to keep the whole population who is not ill healthy and make them even healthier. So we actually, except for some niches, we actually don't work with ill people. Whereas the Ontario Health teams, their focus, of course, is to enhance the efficiency and the effectiveness of everybody treating with ill people. So how to work together is something that's requiring a lot of generative thinking. And one area that we are focusing on and has become part of the work of the health teams is the issue of equity. So, so for instance, the Elgin team is working on, has prioritized COPD pathways. But COPD, again, is not evenly distributed across our health units. So some regions have more of it and some have less of it. So that kind of health equity information and raising awareness about it is a one way that, that public health unit can start to work with our health teams to not just take individuals along a better pathways for COPD management, but making sure that those communities where COPD is more prevalent, that whole community maybe gets a little extra attention. So, so that we're working on that together. Yeah, so that's it. I'll just leave that at those 2 points. Right now, we've been doing a lot of work on our vaccinations. So, lots of work going on again to be prepared for the to get the school immunizations up to date and make sure that everybody is compliant with that. It's an ongoing effort. There's always a group of them students who are not up to date as they should be. And our last resort, of course, is to exclude these from school. But we don't want to see a single child out of school any more than they need to be, particularly as schools and students are recovering from the pandemic and its effects. So there's a lot of work being done collaboratively between ourselves and MLHU and the Catholic and the public school boards to make sure that we can do as much as we can to avoid suspensions. And similarly, last year we had a fair bit of pushback from a very minor, very minimal number of parents, but who were objecting to some parts of the whole ISPA process. And so on a provincial level, there's also discussions between health units and with the Office of the Chief Medical Officer of Health of how to best manage this with an approach that we want to keep kids in school, but we want to keep them actively immune as well. Then the next one. So, yeah, there's a healthy growth and development issue. So, of course, that's, early childhood, early development, school years are one of the key points to start children on a healthy trajectory throughout their life. So I've articulated some of the work that's being done there. One of the challenges that all health units recognize across the province is that data on how children are doing is actually not that rich. We need to work better as a province to enhance our ability to figure out how well or unwell our children population is. And so there's some mention there about the tools that we're using and some of the work that's being done locally to advance that. And this again is in parallel with the province. There's a group called Code Como, which I think I've mentioned as well. Code is the Council of the Directors of Education, and Como is the Council of Medical Officers of Health. We are working together, Code and Como, to look at the tools that we can use to measure how well children are doing in school from a health perspective. So again, trying to find ways of collaborating to both obtain the goal of having a body of children who are growing up well. I think that's about all I'll call it once on in my report at the moment.
Questions on the report? Jim and then Grant.
Thank you. Thank you for the report.
Oh, yeah.
I'll ask you now.
I actually,
Thank you. Are you concerned about the spike in COVID cases?
the
I see
COVID,
there's a graph further on.
yeah, no,
I just thought I'd ask you now.
that's a yes and no. So there's been several big spikes this year, with the percent positivity test getting quite high. I think for this stage, post-pandemic, that's probably the way it is normally post-pandemic. In past pandemics, it's been found that as the years go by, those spikes tend to get less high as the virus mutates and as the community develops more immunity. So that's the part of me that says, okay, this is probably par for the course as we learn to live with COVID. The part of me that is concerned is that the COVID virus and people who are older or people who are immunosuppressed, that's still not a good combination. So it still means that we have a lot of people in our communities who can get quite sick from this. We still are seeing, hospitalization rates are still up there. And so it's that ongoing reminder that all of us should get our boosters and our vaccines for the COVID as it comes around. And also we as community need to be sure that we do our utmost to protect the vulnerable because, they're still at risk.
Thank you.
Grant and then Stephen.
Thank you. Through you to Dr. Locke. With regards to the concerns about lack of information and our youth and starting out school, I assume, is that just mental, like as far as their physical condition, or is it part of the education issue, or is it just?
It's multifaceted. So the idea is to try and get a holistic picture of the well-being of children. So that would involve physical health, mental health, social engagement, those multiple indicators. There are a patchwork of surveys done out there, but they're just not done consistently. There's one that whose name escaped me at the moment, but we have access to, Rufus, but it's quite expensive.
Yes.
Yeah. So yeah. So and so again, it's making not only available, but cost not so costly for some health units to obtain some of this information.
Stephen.
Sure.
Thanks, through the chair. Actually, it was a very comprehensive and a good reminder of how busy the MOH and Dr. Locke is on a regular basis. The only question I have is under 1.2 regional engagement. It's still a very positive thing that's going on, but is there a reason, a rationale two locally and tightly aligned organizations appear to have somewhat differing strategic priorities.
So you're talking about the Elgin OHT and the Oxford OHT?
Yeah.
I think that has to do with, so both organizations went through a strategic planning process. And I think, so I think the differences are attributed to perception of local needs. So I know that Oxford, the need for primary care access is significant. And I think the Elgin felt that coordinated care for COPD, which is quite complicated or complex, was their concern. So that rose out of their assessment of local needs.
And just a real quick follow-up through the chair. And I appreciate that. Would it be safe to say, no assumption, that while these are listed in the report as their key priorities or key strategic priorities, they are intertwined on all these levels when, something might be number 4 on someone's list that's number 1 on someone on the other team's list, but that they're all discussing everyone else's priorities?
I think that goes back to Ontario Health teams and how they connect to one another under Ontario Health. The reason I listed those strategic directions in this report is from the public health perspective. Our job is to say, how do their strategic directions and how does our work and our strategic directions, and how can we be of an assistance to one another for the mutual goal of keeping people healthy and making our community healthier. So that's really why I put it in the report, was so that it's a bit so that you're cognizant of that. That's a challenge for us here in public health as we work with the developing OHTs.
Other questions on the report?
Oh, yeah, I have to talk about measles. It's measles 24/7 lately, and so Susan and group have the numbers right at their fingertips, but I don't think the numbers are that particularly important. But we do have a cluster of measles related to a group of individuals from our health unit that went to a wedding in New Brunswick, where a key guest had measles, and so a lot of people were exposed. And fortunately, the whole health system really worked well. As soon as that case in New Brunswick was determined, the contacts were discovered by the New Brunswick public health system, and we were informed very rapidly. So we were able to connect with these communities and these individuals very rapidly. We were doing well and keeping it contained, and I made the foolish move of commenting that maybe this will be behind us before too long. And then, of course, we had another case that showed up. And you got the press report yesterday that resulted in some community exposures. We are keeping our fingers crossed, but I have a feeling that we'll be dealing with measles for a few more weeks potentially. That said, overall, we've had, the staff are doing a great job connecting with the contacts, and the contacts people are isolating, and so that's good. We also have, fortunately, very high levels of measles vaccine uptake in our younger people in general. I think my memory is that our rates are running around 80 to 90%. I'll maybe have to get Susan,
Carol.
Carolyn, to confirm that, but that's,
Good check, yeah.
yeah, it's about 80 to 90%. And so that means that the bulk of our population has immunity against measles. So hopefully, with that, we will keep this under control and we'll get it keep it small.
Questions on that update? Could I ask a quick question?
Yeah.
Measles, mumps, rubella is a shot in early childhood. There's a booster in grade 7 or 8.
No,
No?
there's 2 shots at 1 year and 4 years, right? Where's you can tell I get a little rusty, but it's 1 year
And that's good forever?
1 year and
Christmas Day.
4 years. Yep, I'll confirm that.
But as an adult,
As an adult,
I'm good.
you're good if you were born before 1970, then you have immunity from native infection that was circulating back then. If you're born after 1970, you should have had at least one vaccine dose. If you have immunity. We are finding over time that one dose is the vaccine isn't giving you lifelong immunity. So the native infection gives you lifelong immunity. So for people who are in higher risk settings, so all healthcare workers are recommended to have 2 doses of vaccine. We haven't yet made that recommendation for the general public.
Is there a test for immunity?
There is a test for immunity. It's a blood test, but we don't recommend that the general public go out and just get themselves tested. It's probably just smarter if you have some concern about your immunity to get your second dose.
Questions? Seeing none then, the resolution that the Board of Health for Southwestern Public Health accept the Acting Medical Officer of Health's report for November 28th, 2024. A mover, Grant, seconder, David Mayberry. Any discussion? Seeing none then, I'll call the vote. All those in favor? Any opposed? That motion is carried. Thank you. And we move on to the CEO's report for November 28th.
Thank you. So my report is in your package, number 5.2. I'm not going to go through it because I know you've all read it. It's more, I just want to focus on a couple of things. So following up on Dr. Locke's comments around the measles management, I will say that it's a collective effort of a number of individuals working with Dr. Locke and myself, and because there's contacts that have to be managed and so forth. So just kudos to the staff who gathered very quickly. This is work they know. This is work they do. So just really appreciate that. And I want to mention that. Also, I think I'll just focus on 1.4. I wanted to confirm that Southwestern Public Health has now been approved as a living wage employer. So we received this confirmation from the Ontario Living Wage Network. You'll remember the Board of Health had a discussion about this earlier this year. And then we also wrote to community partners to encourage those entities to consider being a living wage employer. And I think it's really, it's also about the importance of public health walking the talk. So we talk about the connection between income and your overall healthy life. And so this is just, I think, another good example of why we needed to do what we did to receive certification. So that's been done and it's been granted. So good news there. In 2.0, our strategic planning update. So we're definitely full on in. Carrie behind me here is very capably leading this process in her role as manager of strategic initiatives, together with the consultants that we've hired to support us. I would say that it's been just a real pleasure to participate in a lot of the town hall discussions with frontline staff. There's been uptake on our community survey, and there's been, which is great. We've sort of blasted it everywhere. Please fill out this survey if you possibly can. That's the online survey. And then at some point, you'll come back together as a board and discuss what's next and how to turn the discovery report of all of that data into some meaningful priorities for us to really shape and for you to shape as the Board of Health, the future directions of public health. In 3.1, this is your third quarter financial statement attached to this report. Each quarter, we bring forward a financial statement that outlines where we're at in the fiscal year. Monica keeps a close tab on where we're at, and you'll see at this point we're currently underspent by approximately 1.4 million. And I've explained that predominantly the variances result as it relates to staffing that changes from mandatory funding to one-time or 100% provincially funded programs. But also we were able to tap into some COVID funding for Q1 that we didn't anticipate when the 2024 budget was built. And so that's good news. And so yes, we're in a positive position as it relates to surplus and deficit for this year. 3.2 is pretty self-explanatory. That's the audit engagement letter and planning letter. The auditors have already been on site doing their preliminary work with Monica and the team. And of course, you'll see the draft audited statements next year. We usually bring those forward in April. So that's when you'll see them. But you, as a board, are required to sign the audit engagement letter. And then we get to the biggest part of my report, which is the 2020, I apologize, that's a typo. It should say 2025 general cost shared and 100% provincially funded budgets. You know, we can review this report by 20 people, not 20, I'm exaggerating, but and then we just miss it anyway. But I apologize. It should say 2025. That's on me. But let's get into it. So I'm not going to review the budget page by page. I'm going to walk you through a presentation that summarizes it because. So first of all, I heard the board's comments, I don't know, 2 or 3 years ago, where the 75 pages that we were giving you were a bit too regular. And so we're keeping this obviously at a governance level. And, but I'm going to walk you through what the draft 2025 budget looks like. So, I'm going to reference that the budget is built from the frontline staff's work together with leadership teams. And we do that through the program planning database that, or program planning initiative that we do every year. And this budget in front of you is what I believe to be a reflection of the board's direction to ask for what is needed. So that's how I'm presenting it. It includes certainly finding savings where we could, right down to things like, you know, utilizing Microsoft tools to a greater extent than we have before, because we already have Microsoft tools, and eliminating separate tools that weren't available through the Microsoft platform before, that cost money to maintain. I want you to know that, I want you to be assured that every single time we approach an annual budget development, we are always considering what can we do differently? What can we accomplish with this mandate? What can we accomplish the same mandate with less? What can we make even more efficient? And what do we make, where do we focus to make the most meaningful impact for the dollars we spend? So I'm going to walk. So you'll see I'm going to talk about the road ahead. I'm going to talk about our priorities. I'm going to talk about some population health highlights. And then we have like the expert in the room over here, Carolyn Richards, in case you have questions on that. We're going to talk about the actual budget and strategic alignments, and Monica's going to help me with this. So I'm going to turn it over to Monica at some point as we move along.
Jim?
Yeah, just a question through to the chair. We're passing a lot of motions. Should we not be passing the motions as we go along? Because I do have a couple of questions
Yeah, so
way back.
My plan is and that's a good question. My plan is for the CEO to deliver the entire report, and then I will ask for questions on the report up to budget. And then we will go through these, and then we will tackle each one of the motions on its own.
Because we have to go way back for about 6 motions. Anyway, that's fine. Thank you.
It's 3, but yeah.
Yeah, no, there's a bunch there.
Budget?
Yes. So, okay. Let's go ahead a slide. So I mentioned that all of our budget is based on evidence-based planning. And we look at the current Ontario Public Health Standards. We look at, we now have great data to inform this budget with respect to, we've had years of situational assessments we've done. Because remember, we talked with the board about the need to do some situational assessments based on, post-COVID, it was time to really understand some things happening in our communities. So that has been reflected in this budget. Things like, I'll give you an example of that. That's like Planet Youth or our climate change action plan. And like the board has articulated before, we as an organization, when we do this budget in 2025, we don't have just this budget in mind. We have future work in mind as well. So I want to be sure to point out that this budget is built on the current Ontario Public Health Standards. We know the Ontario Public Health Standards are under review by the Ministry of Health. They're slightly delayed in releasing them. I think we hope to see them for implementation in 2026. So we'll likely see them in 2025 with a goal to be implemented in 2026. And the other thing to point out about this budget is that it is built using the existing funding formula provided by the Ministry of Health. But I want to comment, you'll remember in the Strengthening Public Health Initiative, there were 3 prongs. One was mergers, one was voluntary mergers, one was Ontario Public Health Standards Review, and the third was a funding formula review. And so that is also currently live under discussion at the provincial level. So this budget is built on what we know today and what we're expected to do for 2025. Next slide. So as I mentioned, I think we have more data to inform our 2025 budget now than we did when we were still doing some situational assessments, which is good. I mentioned that I think for us, those situational assessments that I've referenced are producing data that really illuminates the status of certain things and that we're translating into program plans. So we still meet the mandate, but it's the how we do that and where we focus that we're using that data from situational assessments to inform. Emergency readiness Our job really is to be ready for whatever emergency arises in our community, and preparedness is key, obviously. Just went through a global pandemic. But there are learnings to apply for other emergencies as well. And so there's work here to be done. And it's not work just done by public health. It's work done together with our municipal partners, together with our community agencies, et cetera. Health Human Resources, I put this on the slide because I think it's a challenge everywhere. I think the volatility in public health system is really already creating a challenge given the uncertainty. You know, we've got new Ontario public health standards. At one point, they were talking about mergers, potential funding changes. And to be honest, the sheer exhaustion by many public health professionals across the province, probably across the world, with respect to leading the pandemic for the length of time we did. And then really, we didn't let up on the gas. We just refocused our attention back to other work as well. We also, I think it's important, I put short, mid, and long-term objective realities there. I think it's important we have to focus on all three. So successful public health work is about quick wins, but it's also about the long game and the ability to influence change for generations. That's where we make the biggest long game difference. So this budget reflects that. Also, our population is growing. I put that chart on the slide because I thought it was quite telling. It's growing and it's fast. And these are just, this is just to 2027. These population projections, they come from Ministry of Finance from 2022 to 2024 population 2022 to 2046 population objectives. But you'll see we're growing, which is not a bad thing, but it's, well, I guess I've heard some people say that comes with its own set of challenges, right? And so I thought it was important to reflect that. Next slide. So, income and expenditures. So, they're pretty clear. About 78% of our budget is people. This budget has no FTE increases in the budget. But that doesn't mean this budget is a status quo budget. What it means is that it's maintaining momentum. So we also have other factors that are at play. So we have a 1% increase in provincial funding this year. That's a known. Remember previous years in public health up to last year, we didn't really know what the increase may or may not be. The province, as part of the Strengthening Public Health Initiative, they announced that public health would receive 3 years of only 1% growth funding per year. So 2025 is part of that. In addition, 17% cost in employee group benefits for the current plan. So this is about not enhancing benefits. This is about our existing benefits. That's an impact on our budget. We have collective bargaining, both a settled collective agreement and one coming up. And I wanted to point out there are no FTE increases, but as I mentioned before, we're not letting off the gas. This is about maintaining momentum. Next slide. This is where we get into all good things data. So you've seen a lot of this data before, and Carolyn and I have talked about, is there even more up-to-date data? Some data we have up-to-date and some we're just at the mercy of what data sets are available to us and when they're available. But anyway, I think it's important data. You'll see the in our minds, this budget package is a representation of dedication to the well-being of our communities. You'll see that it's a continuation of the board's commitment, repeated commitment to improve health outcomes. School age vaccination rates over the 3 years examined, the coverage rates for vaccines to prevent Hep B, human papillomavirus, and meningococcal disease have all decreased over time. Alcohol, the local rate of hospitalizations attributed to things like alcohol attributed to alcohol, liver disease, for example, accidental intentional alcohol poisoning, etc., reached an all-time high in 2021. Institutional outbreaks, yes, those continue. More than twice as many institutional outbreaks occurred in 2022 compared to 2019. That was 2 years into the pandemic. Mental health, I think this board has talked a lot about mental health. Residents of this region, age 12 and over, increasingly rate their mental health as poor or fair. This proportion nearly doubled between 2015 and 2019-2020. And vaping and cannabis. So greater proportions of youth reported vaping and cannabis in the past 12 months compared to Ontario. Vaping, 32% in our region compared to 22% in Ontario. Cannabis, 25% compared in our region compared to 22% in Ontario. Moving on, let's move on. So you'll see, thank you. So the goal here really is to achieve compliance with the Ontario Public Health Standards, and this budget reflects that. You sign an accountability agreement with the province that says you will meet the Ontario Public Health Standards. There's also, in that accountability framework, there's also lots of pieces to that. There's the delivery of programs and services, there's fiduciary requirements, there's good governance and management practices, there's public health practice. What was
Green.
there's a lot of work that goes into the accountability agreement you sign with the province translates into the programs and services that we do and how we hold ourselves accountable for them. Next slide. So program costs. This is a further snapshot of our obligations. All of these things and more are required of public health units in Ontario. And we just picked a few things to highlight. Next slide. Monica, over to you.
So you can see this is our budget summary for our mandatory cost share programs. So similar to what we talked about earlier in the orientation portion, this is what is cost share between the ministry and the obligated municipalities. So this is maintaining the budget at its momentum. So this shows that overall 3.9% increase over the prior year. So right off the bat, I just wanted to highlight that you're not seeing the first budget we developed. You're seeing the budget after all the information's assembled and we carefully consider with our teams what we're going to do and what we're actually able to do. So we're cautious not to spend too much time focused on the program area and why one year might look different than the other. So I just wanted to highlight, if you look at the column where it shows the differences, you will see that there are some variances. So it may look like one program is spending less time or money than another, but in most cases, this is just an allocation of staffing. So for example, if you look at immunization, it looks like we're spending less money by 93,000, when in fact it's just an allocation of staff. So we haven't actually reduced any of our FTEs. This would just be an allocation of either nursing staff or program assistants. The only thing that I will say is that we have reduced this budget by 6 students. So overall, the FTEs have remained the same throughout the budget. Again, just highlighting a 3.9% increase, which I think is pretty reasonable based on CPI this year. And this part here, this is our 100% provincially funded program. So as Cynthia noted this morning or this afternoon in our orientation, these are the programs that the ministry pays for completely. So that's the MOH top-up funding and our Ontario Senior Oral Care Program. And again, the MOH funding is based on the application. So I think we noted last year that historically they used to provide significantly more. They've now increased what we call our base requirement by the board. So the Board of Health is required to pay a certain amount of the MOH salary. So that has increased over the years. And then the senior oral care, although it looks like it's declined, this is because historically we've been provided an amount which again is set at just over 1 million. And although we asked for 1.5 for 2024, the funding letter came in at just over 1.1 million. So based on David's team's review, they've established an amount of 1.2 is what they'll ask for in 2025. And of note, with the new federal oral health commitments, staff will undertake a review of our oral health programs to ensure we're not duplicating anything that may be provided federally. So these are our one-time funding requests. So we are going to ask for the public health practicum students again, even though in 2024 they did say they were going to cancel it. And then they did say verbally they would reinstate it for 2024. Although to my knowledge, we've still heard nothing about that. Also, as we discussed earlier, we've been told that we need to absorb COVID work as part of our infection work again. So if there is an opportunity, we will of course ask for additional funding, but in the meantime, we have now created this as part of our mandatory programs and services. And then the IPAC hub funding, it also looks like it's less than last year, but part of this is because the ministry is now flowing dollars directly to MLH and Huron-Perth, and coordination from SWPH is not required this year. So that's why you see some of the differences in comparison to last year. And then the two on the bottom, we had asked for, as you know, last year, or as part of this year's funding request, and it was not received. And then again, these are programs and services that are funded by MCCSS. And again, as we discussed, we do provide a budget, but it's based on an allocated amount of money we receive. So we don't get to request funding. They provide us what the allocation will be, and then we work backwards from there to determine what we can put in there. But you will see that for the first time, we did get an increase, which is about 7%. So I think that's the first time we've had an increase in
12 years.
Yeah. So since I've been here, it's been status quo. So since, yeah, over 12 years. So here's just a summary of what the overview looks like, the two different pots of money. And then as we've talked about at great length, you will see quite clearly again that the majority of our funding is in fact related to staffing, with it being 78%, which I don't think is surprising. Corporate services has some costs for things like materials and supplies, human resources, communication, strategic initiatives, privacy, all of those types of things. Obviously, our favorite part, the money. So this is based on what our ask is today, which is just over 21 million. And again, that highlights a 3.9% increase. So that shows you what the expected amount is from the ministry, which we do know is an established 1% increase. It highlights what the 1% increase is to the municipalities, and then what the additional funding is, which is just to maintain existing services. So that right there is about $605,000, which would be paid by the 3 municipalities to cover the difference in the budget.
I think, yeah, I think that is about it. I'll maybe just say 3 quick sentences. This budget maintains the momentum. It is a reflection of what the team feels and I feel we need, part of that team. And I think it's a responsible budget as well, because we have 2 very big looming things coming for 2026. We have new Ontario public health standards that we do not know yet. And we have a strategic plan that's coming. Actually, make that 3. And we have a funding formula review, a potential new funding formula for public health for 2026. And that, I think we'll leave it there.
Thank you. So bear with me, work with me. Administratively, we need to take a look at the entire report. So I'm going to ask the board, do you have any questions on the report of items leading up to and including 3.2? Jim?
Through the chair, a comment and then a question. Thanks, Cynthia, for sending out the little bulk headlines, letting us know what's going on instead of reading it in the papers. That was good. Thank you. And secondly, what's the time frame for the Jill Thornton, December 11th? Is there a time you can go in to get the shot, COVID shot?
Oh, you're referring to our clinics.
Yes.
Yes, that's item 1.3.2. Susan, is it 10 to 3? 10 to 3.
10 to 3. Thank you. Okay, thank you.
Jim, thank you. Any other questions leading up to and including 3.2? I don't see any online. Seeing then let's administratively take care of a few motions. The first motion is around the 3rd quarter financial statement. And the resolution reads that the Board of Health approve the 3rd quarter financial statement for Southwestern Public Health as presented. Do I have a mover? David Warden, seconded by Mark Peterson. Any discussion? Seeing none, then I'll call the, did you have discussion? You're just preempting? Yeah. So you're excited. All those in favor? Any opposed? That motion is carried. Thank you. Our next motion administratively is that the Board of Health approve the board chair signing the engagement letter and audit planning letter received from Graham Scott Enns as presented in preparation for the upcoming 2024 financial audit. Do I have a mover? Grant, seconded by Jim. Any discussion? Seeing none, I'll call the vote. All those in favor? Any opposed? That motion is carried. Thank you. And now we will move into item 3.3 on the CEO's report, the 2025 general cost share and 100% provincially funded budget. Questions on that section of the report, Marcus?
2 brief questions, and then I'll go to the bottom of the list before I make any comments. You mentioned the growth numbers. I just want to understand them. I know it was an earlier part of the report, but in the context of the budget, the growth numbers that you used, what was the source of those growth numbers? Was it Ministry of Finance?
Ministry of Finance.
Thank you. Second was, you mentioned, Monica, in the overall budget summary, 3.9% being a relatively moderate, reasonable number, which I agree with, compared to CPI. What was the CPI number that was used to build this budget, or referenced to build this budget?
I think it's sitting at just around 3% for the average of 2024.
Okay, thank you.
Any other questions? Grant?
With regards to the 17% increase in benefits, I haven't seen that at the county or the township. I'm just wondering, can you elaborate on that?
Yes.
Yes. So this is an estimation that we're receiving from our provider for our whole comprehensive benefit package, which includes extended health, dental. Derek, I'm looking for
Dental, long-term disability.
long-term disability. Thank you. Life insurance, etc. I think we so prior to the budget, we reach out to understand what the what the potential increase might be. We understand it is usage. That's the biggest driver of the benefit increase. But before I finish that statement, I'm going to check with my resident expert over here. Derek?
Yes, utilization and cost of pharmaceuticals is predominantly the driver of that. As you know, as more of the pharmaceuticals move to biologics, that those go up, as well as the utilization of those drugs as well. So we also are part of what's called the Public Health Consortium, which is a number of other health units who also are in a very similar state. So we survey a number of other health units as well to understand where they are at as well. And we know that their benefit premium costs are roughly between, I think it was just over 10% to from the individual health units I heard from, I think just under about 25% for adjustments for this year. So it's a less of an adjustment than it was last year, but again, it continues to go up based on these costs in terms of the utilization for them.
David Warden and then Lee.
Just a couple of quick questions. Do we, as far as the policy is concerned, do we shop that policy at all?
Derek?
Through the chair, yes, it's done on a regular cadence. I believe it's every, I forget the actual amount, but I believe it's every 3 years. To that there's a group kind of market review to make sure that the carriers are being competitive.
And the other one, if I may, through the chair, is the fact is you say because of usage, correct? Could you just elaborate a bit on that, what that means?
Through the chair, utilization meaning that there are more claim submissions. So we have individuals who may be needing more pharmaceutical needs in terms of more prescriptions, more dental visits, more utilization of our paramedical benefits, whether they be physiotherapy. So that means utilization.
Okay, and through contractual agreements, is it limited, right? Is this limited by, as a result of contractual?
Yeah, so there would be amounts that will be allocated within our benefit agreements.
Right.
So in other words, like, for example, X number of dollars allocated to physiotherapy or
Okay.
Utilization of generic medication.
Thank you.
Lee.
Yeah, through the chair, the owner contract, when was it up and when is it up? The actual contract, is it up now or?
It comes due, it expires December 31st, 2024.
24.
We're already discussing with them negotiation dates.
So looking at some of the ones that have been addressed, there's some pretty high amounts being put out there. How does that impact on the budget here? So I mean, I know you've built some into the budget for increase, but if it's, and I don't know how much they're going to get, obviously, but it sounds like there's some fairly high.
So I suspect that your question and the answer to your question might be something that we would need to rise into closed.
Oh, okay, I get you. Okay, sorry.
Does that give you enough of an answer?
Yes, yes.
Okay. David, were you responding to that?
I was just going to say this is a closed session item. We can't
Yeah,
discuss it.
sorry.
Other questions on the budget as presented? Grant and then Marcus.
Thank you, through you, Cynthia. So when we're moving staff between programs, some are fully funded, some aren't. How do you track that?
Well, it's a giant spreadsheet. It's our annual service plan, and we track our FTEs through that as well. Monica also keeps detailed spreadsheets about who's where. The movement, I'll give an example of the movement. So we might have, let's say, 4 nurses, 2 health promoters, and 1 program assistant to a program area. But then we decide, based on the work ahead of us, we actually need 6 nurses and 1 health promoter and 1 program assistant. So that's the kind of movement you see, where you see, oh, well, then that health promoter winds up being charged to a different program area because we need more health promotion somewhere else. So that's why there's where you saw the chart where the numbers looked like in some cases, the program areas went down. That's the movement I'm referring to. Does that answer your question?
That's what I was asking.
Okay.
Marcus?
I'm good.
David Warden, thank
Yeah.
you. And then Stephen, sorry, I've just noticed you there.
Okay, so you're proposing, I just play along with this as I'm leading to somewhere here. You're proposing a 3.9% increase on the budget, correct?
Overall budget, yeah.
Overall budget, of which you've broken down to the different municipalities, how much it's gonna cost them.
Which
Okay.
is more than 3.9%.
So my question becomes is, has there been thought, and I brought this question up at the last meeting that I was at, is when we got discussing surpluses. Do we want to go down that road as far as we've all served on councils where we've had surpluses and we decide to use some of that money to offset maybe the overall budget. Has there been any thought given to that, or I just open that, throw that out on the floor with the $1 million you're proposing, correct? That could be a surplus. Do we want to go down that road? Okay, let's go to the original thought that I had last time is what is the game plan for the so-called $1 million surplus?
Cynthia?
That's an entirely board decision and discussion.
Okay, that's why I threw it out there. Thank you.
So discuss it during this orientation anyway.
Stephen's next.
Yes. And is your hand up also?
Yeah.
Okay, so I have Stephen, David, Marcus.
Thanks, and through the chair. And as others, reinforcing all the work that the entire team does to bring this information together, and that it's been vetted and reevaluated, and a lot of serious conversation. Just first of all, to the resolution, that's exactly what the resolution means. It's proving the business plan. That's the work plans for the fiscal year, and the budget, primarily the cost shared programs. So the chair, you're just confirming that's what this is speaking to, correct?
We don't have a motion on the floor yet. We're
No,
asking
that's-
questions of the budget as presented.
Okay, well, that's what I'm going to speak to. Okay, but thank you. Looking for either confirmation or correction that there was a mid-year amendment to the requirement of funding to the partnered municipalities in the 2024 year? Or is that the year before?
That's
23.
23.
24.
23.
We
Year
need
before.
advance to the level of service. Oh, no, you're right,
23.
it's 2024. Sorry. Cynthia.
That was in June of 2023 for the 2023 year and beyond.
Okay, so okay, I appreciate that. So nothing, 2024 was passed, inclusive, and invoices sent, paid, and there were no other changes, and we're looking at 2025 now. No, I'm satisfied with that, as answering a question that no matter what happens in the subsequent conversation, that due diligence has been done. The programs, I think, represent a solid value for the money paid. And I guess I've mentioned it in this environment before. Public health is not the only thing that the local municipal partners fund. And the capacity for local residents, especially those who are more likely to use and need the services of public health, are the pressures of additional taxation on them raise are pressures that impact other types of health as well. And I think yeah, maybe it's just a message that we need to be collectively aware that public health is our adherence to public health can come through many avenues. So thanks to the chair.
Appreciate your earlier question, David, and then I believe it's Marcus.
So a couple of comment or questions, but I'll start with the comment to Stephen's last comment, that the people at the lower end of the social economic scale tend to use more services and need more attention. I would also suggest that they pay less in taxes. So the burden of this is in fact less on them and the benefit could be more. So I think there's, taxes are really about equalizing the economy. And this is one of the ways, and it seems a little bit backwards here, but this is one of the ways to do it. So getting back to the real question, and I'm not sure whether Cynthia or Monica wants this one, but the first one, it seems to me we had about 300,000 in reserves last year. Is any of that in this budget?
Cynthia?
255,000 sitting in reserves from last year,
Is in this budget?
It's in reserves.
sitting in reserves, sitting.
So my question was, did you put any of it into this budget to reduce the cost? So
No.
we've left the reserve.
We can't do that because only the board can decide
Okay.
what to do with reserves.
So then the second question is around theoretically having $1 million surplus. If we follow our, and I guess I don't know this, the answer to this, but if you look at our cost shared versus 100% funding, we're in the 92, 93% of our budget is cost shared and about 7% is funded 100%. The $1 million, then it makes a difference whether it was in the 100% funded or the cost shared funded. And then do we take the 70-30 number or do we actually take the 62-38 number? Because if we have to send that money back, if it's not ours, and if we have to send it back, then I kind of want to know whether I'm sending 100% back or 62%.
Cynthia?
So in answer to your first comment of that last question, it's about 88% and 12% is, well, sorry, that's MCCSS. So it doesn't matter. Anyway, sorry, your question matters, not my comment. That could not come out right. But I will say that. What's that?
Nobody objected to your.
But I will say that Monica, I think, is the best person to answer this because we've done some inquiry about that $1 million surplus so far. Okay.
So the ministry has a bizarre calculation that they use to create what their portion of return is. And we've challenged them. We've challenged them on it significantly because I don't agree with their calculation. So after a lot of back and forth emails this year, they have agreed as of Q3 that that million would be solely the board's.
So we utilize their money first and then ours.
Well, it's not just that, but it's just that the allocation of their calculation historically has been like a 75-25 split, which is not accurate because you contribute at a different rate than that. So if I use the rates that they've provided and based on what's left, in fact, that full million belongs to the Board of Health. And they have agreed to that in writing in an email,
Yes.
which I have saved.
We get copies of them.
So
So
it makes quite a difference
it makes a huge difference. So
to the board though, as to
Yes.
the utilization and as we get, so we probably should be talking about the actual budget and then how it's funded is actually the secondary conversation, right? But so I'm supportive of the budget. I realize there's a few ups and a few downs, but as I look at the actual program numbers, tend to be, I think the money is well invested. So leave it at that, and then we'll get into the funding, I'm sure.
Marcus? I think you're next.
Thank you. For you, Chair, following up on David's question about, the surplus and has there been consideration as to what to do with that? My question, I guess, would be, do we have any, asset management concerns or anything that we need to be allocating that surplus to, in terms of this building or other facilities that we have? Yeah.
I would say at the moment, nothing specifically, but we also know that we have the ability, they've not, again, provided yet, but there is the ability for funding for buildings for capital under $1 million. So if you have a specific need, building related or capital in nature, you can request that specifically from the ministry at 100% funding. So similar to when we talked about the facility, future facility, same sort of thing for this building. We could request funding for that.
Cynthia?
Yeah, and I would also suggest that, ultimately, it's the board's decision about what to do with a reserve or a surplus. But when you're running a business of 20 some odd $1 million, it it is wise, in my opinion, to have some money set aside in case you have unforeseen expenses. The reality is the board owns this building, for example.
Other questions on the budget as presented? Right, seeing none, there is a resolution that has been prepared. I am open to amendments. The resolution is that the Board of Health approve the 2025 budgets for general cost shared program for 100% provincially funded ongoing initiatives and for 100% provincially funded one-time initiatives as presented. Do I have a mover? Jim, do I have a seconder?
This is the 100%, yeah.
This is the 100%.
This is the budget.
The budget,
Just what's presented.
The whole thing.
the whole budget,
With this result.
the 3.9.
Yeah.
Okay,
Stephen is seconding, I think.
Stephen, are you my seconder?
Yeah, I'll be pleased to second it. And that's
Thank you.
all the wording that is on the floor.
All of the wording and numbers. And so, as the mover, Jim, you have the first opportunity to speak. Coming to you.
I'm fine.
Stephen, as the seconder, did you have anything you wanted to say?
No, I appreciate the opportunity. Thank you.
Thank you. David Warden is first and then David Mayberry.
Well, just in keeping in tradition, I'll ask for a recorded vote, please.
Give me one moment to note that. Mayberry?
So given the fact that there's going to be a surplus and given the fact that we do have a policy that says we're aiming for about 5% in it. And while I don't actually really want to do this, but I think it actually makes sense, given that in 2025, we'll be looking at new public health standards that we don't have any idea if they up or are they down. We're also looking at a new funding formula, and we have no idea whether that's up or down. We also know that we'll have a 2-point-something% population growth. I have no idea where inflation is going. And we know that we'll have a contract for employees, and we don't know where that's going, right? This is November of 2024. We're talking about 2025. So I don't think having $1 million in surplus is too much. Given that, did you say 255 is in surplus now? Reserves. I'm sorry. Thank you, David. I'm wondering if we shouldn't add 255 and 745. Take 745 out and put the other 200 and whatever to offset the cost. That would get us up to our kind of almost up to our 5%.
Is this a point of discussion or are you making an amendment to the resolution that's on the floor?
Well, I guess I thought if there was some kind of support, I would make it a motion that we use the reserves to build, use the surplus to build a reserve to $1 million, and that we take whatever's left year end. And I know this kind of throws a bit of a ball into Monica's court here, but whatever we have at the end, then we use that to reduce the levy increase to the municipality. So that would be my amendment, however you want to word it.
Okay, so do you?
Just take the 255.
I'm just trying to decide whether that's an amendment or a resolution.
I think it's an amendment. I'm prepared
It
to.
was
go down the
intended
road
to
of
be an
an
amendment, so.
Okay. Do I have a seconder on the amendment that is loosely worded?
I get clarification. So we're at 255 right now?
In surplus.
Yep.
No, in reserve.
In
Sorry,
reserve.
reserve.
And you want to add, you want to make it $1 million? Is that what you're saying? So that's 745,000?
745 more.
Okay, and then the rest of it,
And then if I believe I heard you say, and use that reserve towards this, but no, just put it.
Use this, the remainder of the surplus. That's why I say this makes it difficult for Monica because we don't actually know till December 32nd how much we've got. So there's going to be about 200, 235, 40, 50,000.
Okay, so I have a secondary in Mark Peterson. Do you have that way? Marcus, David, Jim, Grant, we'll just go around the table.
Can I just suggest that I'm not prepared to vote on this at all until I see something in writing exactly what it is and I can ask
Yeah.
Monica a question about it? Because right now it's not clear to me what this is and what this isn't.
I would agree.
So.
Can we give staff 2 or 3 minutes to put it together? Would that be helpful?
Yeah, I just,
Or Mayberry could, because it's his idea. I mean, I know he could write, he could,
Not that you can read.
Easy.
Okay,
So-
Cynthia first.
so to Marcus's point, so first of all, I think I understand what you're saying, David. The issue is that we don't know what our 2024 surplus will be until the audited statements are complete and presented to the board for April. Now, we have an idea. We already know that we're projecting $1 million surplus so far. The year's not over
Mhm.
and it's not official until the year closes. But, so if it's an amendment to the resolution, so, sorry, to Marcus's question, I cannot give you an exact number. Monica cannot give you an exact number
nope.
because we do not know the amount. But we can give you an idea.
That's what.
Do you have a follow-up?
Yeah, I'm not looking for an exact number from staff. I'm looking for an exact number of what the motion is that's on the floor that we're even considering.
Oh, I'm
That's what
sorry.
Because to me, until I know what I'm debating, I don't even know if I want, maybe I don't even want to know that.
Yeah, yeah,
answer.
I got you.
I just want to know what it is.
I think the easiest way to do this would be, if Dave would agree, is just put a motion on the floor to take the $255,000 out of the reserves, right? And put it towards reducing to the municipalities. That money's already, we know that's there. And then to add to that resolution, whatever the surplus is, you put that back
Carry
into the
forward.
reserves. Carry forward. It's
done.
done. Done.
All right, a 5-minute break to get this.
I should be able to respond. I would just say, we could do it that way, but it would be much simpler and it would get exactly the same result.
No, it isn't simpler because we don't know the number in the surplus, in
We
the,
don't care because whatever the number is goes into reserve.
but that doesn't mitigate today's budget in front of us.
There's no motion on the floor. We're debating a thing that's
There's
not
a
even.
motion on the
Yeah,
floor.
there is a motion on the floor.
We're
The
debating the
amendment.
amendment and there's no motion to amend anything and we're debating an amendment. We need to,
Yes, we need to articulate the amendment so that we can debate that and then get back to. So, Jim?
Okay, so, thank you. And this will just be me speaking out loud. I think we're confusing ourselves here right now because this is just a budget. We can pass whatever we want today. 2 weeks from now, there's unknowns, come back, we put it in the budget or take it out. It's pretty simple. A budget is a budget. It's not in stone what we passed today. We can change it next week. Information comes, click, we put it in the budget and then we vote on it again. So I know what David's saying, but we don't have to decide that today because it's just not in stone what we're passing right now.
I would suggest we actually do need to, for a couple of reasons. One, the public that we are accountable to. Two, our obligated municipalities are putting together their budgets that must be passed. And so we need to have a number
And I'm
for
happy to
them to
pass the
consider.
budget at 3.9%. And with all the unknowns, can happen next week, they can change. They're no different.
But there is an amendment on the floor suggesting
So I don't
otherwise.
say we don't need the amendment. It's just pass the budget. If we have to make some changes next week, we make it. Comes back to the board and these questions can be answered. Because
Stephen?
we don't know. Anyway, just my comment. I learned a long time ago, a budget is just a budget. It's not in stone. It changes.
No, I concur with the chair that I think we're here to make a decision on this. But I would also suggest that if there's an amendment that in any time or place, it should be prepared and ready to go. And that's, I've learned from a number, some in this room, and learned that respect and continue to respect. And I would just hope we could move on this one way or the other relative to if indeed there is anticipated to be an amendment. But thanks to the chair.
Thank you. So David Mayberry, I need your words articulated for a way to document them so we can all know exactly what we're talking about. And then I will need the seconder to the amendment to agree to that. So
So
Do you
If
have
I
word
may.
written out that you can email to Wei in very clear and concise?
No, because I can't hook up to the thing here. Why don't I just do what David Warden said, is that we use last year's reserves,
Current reserves.
current reserves, thank you, to offset it, and that any surplus from 2024 go into reserves
Okay.
for future years. It's virtually the same number of dollars.
It is, but clarity. So does everyone understand what he just said? As the seconder, do you agree to that, Mark Peterson?
Yeah, that makes
Okay,
sense.
Okay, so we got it.
So
okay,
Jim is the original motion.
but I have to deal with the amendment first.
Oh, I'm sorry. Listen to me.
She knows what she's doing.
I know what she does.
I was trained well. Someone ring a bell.
Those in favor of the amendment?
Any discussion on the amendment, Marcus?
Could I have Wei read it back so that I know what it's gonna say in the minutes, what we're voting on?
Here's a suggestion, that the Board of Health approve the 2025 budgets for general cost shared program for 100%
Sorry, he just needs the amendment.
Just the amendment.
with amendments as directed by the board.
No, we need the wording of David's amendment
So
to
the
take
amendment
the existing surplus and
Existing reserve.
apply it against
The reserve.
The existing reserve be applied against the 2025 budget and
She just took one, but she missed it.
to offset the levy. And that any surplus from 2024 be put into reserve.
We'll change it.
That's a fairly simple script.
So did you get David Mayberry's wording?
With following amendment, take the existing reserve in the amount of 255,500 to offset the existing levy to the board.
No.
the existing levy on the budget,
On the,
2025 or whatever.
to the,
No, to offset the proposed levy, because we haven't passed the budget yet,
Thank you.
to offset.
for 2025, and that any 2025 surplus be put in reserve.
Did you get
Did you
last
get that
part?
second part?
So I wrote, and that the 255,000 reserve be applied to the budget and the remaining surplus be,
Yeah, we've
Right.
changed that.
I'll put it in
Same,
reserve.
same numbers.
Yeah,
but-
that's what he just said.
Stephen, I will get to, I just want to make sure we get this wording before we, add more dye to the water.
And how's this? To take the existing reserve in the amount of 255,500 to offset the proposed levy to proposed levy to the 2025 budget. I'm sorry, I'm missing.
Yep. And that the year ending surplus.
Yeah, let's, hold on just a second. I think what's happening is we've got like 3 people talking.
Try and move
So-
it. We take a 5-minute break and take the pressure off staff.
That would be, I would appreciate
Yeah, I
that.
think so.
Okay, well, you can't move it because we have a motion on the floor, but let's take a 5-minute break.
All right.
Thank you.
Point of personal privilege.
Yes.
David,
Yeah, go ahead. This sets the levy on the
you
municipalities.
just make that bigger and that way David can see it and he can tell you whether that counts.
Yeah, I have no idea. Up to your.
Marcus.
Where's the?
Marcus. That deal as smart as apple on a bushel there, buddy. Oh, Lordy. Call the vote. I gotta-
One of the LCBO.
Right there.
Yeah. Not only that, I think.
Budget. Surplus we put in.
just. It's been 45 minutes of December. It's the weather was awesome. 18. Yeah, it's a nice getaway.
Nobody else can reach.
That's all you can ask for. Thank you for asking.
Okay.
Line to reserve. Five?
Carries forward.
You got this all marked down for me, 25?
To. Just like.
Well, no, it makes sense.
We all know.
Yeah, just get it wording, yeah.
So normally I would.
Can't predict, you can't predict.
Think-
255 is there.
Yeah.
So that's,
And then the.
yeah, whatever there is, yeah, exactly. I mean, that makes the most sense.
You don't have to worry about the number.
Yeah.
So he was great. Yeah, it's true though.
So we're seeing.
You're basically giving.
So we would be the one that the bus would run over. So we have 202. So that we in reserves for increase in your license. Okay, yep. So actually before today, 300. Yeah, so. It's fine.
It's not like.
Waiting. Now it'll go down a bit. Some money towards it. So we'll get a percentage. That's what I'm saying. Also by percentage. It should. Yeah, I want to make sure it's right. That's all.
Yeah. My dinner.
Date is so big. I said, it's
Massive.
Dean, I wouldn't want to eat it.
No, I know.
Everybody is going to take that.
Oh, that's what it sounded like. Jesse, we need lots. No one wants to eat in public, but everyone wants it.
Well, that looks like it'll be.
Yeah. Oh my God. Yeah.
I feel like that's what.
Are you? These are me. Oh, my goodness. Perfect.
Clear as mud. Perfect.
Yeah.
They said that way if they ever. We were talking.
Yeah.
2 hours.
Okay.
So we had put away 300 for something in our budget. I think the difference was an increase 31 or something. Peter, you coming in here today? So that 250.
Gotta go.
Oh, and keeping that reserves for your. Only makes sense, right? Would be.
Yeah, you know.
No, it's just working out. Sleep person. That's the other one.
You know?
You send me an email.
It's good. It's like the expert tell me. That ain't, I need it, right? And so that's the most action.
Reconvene, please.
Yes.
Thank you, Ed.
And the reality of that is exactly what this happened.
I don't. Lee, I think we're at the end, so.
There's nothing.
It's a round number.
Well, you are, but not anytime.
Thank you. Thank you for reconvening. We are back to our work here in front of us. So for clarity, I will ask Wei to read the amendment as that's what we're currently considering.
That the Board of Health approves.
Just the amendment, sorry.
Oh, great. To take the existing reserve in the amount of 255,500 to offset the proposed municipal levy of the 2025 draft budget, and that any 2024 surplus be carried forward to be applied to SWPH's reserve in 2025.
The mover, you're good with that? The seconder, you're good with that wording? And so now I will ask for any discussion specific to the amendment. Stephen, your hand is up. Can you see us?
We
think
can't
you're on
hear you,
mute.
Stephen, you're on mute.
Yeah, confirming who the mover and seconder were?
David Mayberry and Mark Peterson
Of the amendment.
Okay.
of the
And we're
amendment.
speaking to the amendment now?
Yes.
Because the answer to my first question with this text alleviated the need for amendment, but are we talking about I just had all my material. Oh, so sorry. And of course, someone's at the table. Are we talking about a net overall budget of $21,105,035?
Exactly.
Okay. I'll be supporting the amendment if that's what that means.
Thank you. Marcus, to the amendment, please.
I'm looking at page 28, the final page of the draft budget. Yes, that one. And I'm wondering if we could get some of those numbers revised in front of us before we finally vote on it, just so we know what the exact sort of dollar and percentage impacts are. Page 28, the last page of the draft budget. The one that.
Yeah.
The chair.
So I think what you're asking for clarity, so the final number of 604,995, what that number is now minus 255,500, and how that breaks out as a percentage to the 3 obligated municipalities?
Correct.
We can. Do you need it? Oh, perfect. Can
Well,
it
we're
be
ready.
shared to the screen? Or is that the easiest?
Beautiful artwork. Oh,
It's coming.
Patience grasshopper.
We were saying the same thing looking at you, Stephen.
All right, okay, we're coming, folks.
We are just waiting. They're fixing those numbers. They're trying to.
Someone
getting
needs to
posted up there
comply
so we can all see. Yeah,
It's a bit of a delay. Waze clicked it.
she hasn't. She's just trying to project it up on there.
Okay,
That's why
there
we
we
have
go.
your age.
Oh, I'm not.
Didn't pull.
Our system slack on the computer expert. You can sit there and wait for 5 minutes to switch over. 2% of.
Yeah.
60.
3 for Oxford, 61 for Elgin, and 51 for Elgin, or sorry, St. Thomas.
Yes, I agree.
Down 100.
I'm rounding them off to
Yeah,
the closest thousand.
Yeah, down 143 rocks is what you're saying.
Yes.
Yeah.
Just under 200.
Yeah.
Favorable word. All right. All right.
There you are.
Monica, could I ask you to verbally summarize the change in due to the amendment?
Oh, too big. Happening. It's not too.
Oh, so the 255,500 has come off the original amount of the levy for the additional levy for the municipalities, reducing it to the 349,995. So that shows the revised amounts to the city of St. Thomas, Elgin County, and Oxford County.
Okay,
Did you read the numbers out loud?
Or point
I think
two,
you should.
something.
Yeah.
Just one. Just make sure it's not-
Because in 50,000.
Seems like. Sorry, one second.
That's okay. Take your time. But we need to get it right.
Yep.
Yeah, I would prefer them not to be on screen. Okay. I was watching this math. 1 second. Cynthia's famous words, please stand by. Stopped. No, I was just checking around. Sorry.
Is that time?
I just did it under here. This is so, that's great. Takes 30 seconds to clear.
There he is again.
is that the Grinch?
Big as life.
Hold on, Stephen. We are making sure that the numbers are accurate in the formulas in the spreadsheet.
Yeah, well, I'm not speaking out of turn. I believe we're
Actually, you are.
$500 out. But
If you can just hold on,
Rounding it
please.
up.
if, yeah, okay.
$400 million budget at the county. Even a $20 million budget. Spending a lot of time on.
No.
Wonder what a staff rate is here per hour.
We're over.
Are you suggesting that if your amendment had been worded in advance, that we could save the $500 in staff time? Is that what you're suggesting?
I think that's what you're getting
Over
to.
budget.
I'm just reminded of the last county council meeting.
Yeah.
We're still waiting for the final wording. Is that what you,
No, the numbers.
the numbers? Okay.
So what do we have? Budget?
Oh, out there.
Put the right numbers in. Let's just pass the amendment, put the right numbers in. You know what you're saying.
255, 143.
Yeah, so- Can we add, here's the numbers in?
Something I think. You know, already. Yeah. So that's.
Yeah.
Yeah, so you got three, you got another. Which isn't really.
We're not debating.
No.
That's what I said. Well, now they got.
Not shy.
Next year, we're start getting into. That's why I have numbers showing it gonna be in a session for that.
Yeah.
Because now they know how much we got.
We want the total levy number read.
That's why. it
Total
was-
amount for the additional services.
It's the
It's
change.
Marcus that asked the question, so let's ask Marcus.
I was really looking at that whole,
Yeah, so the one, like, for example, the city of St. Thomas, 1.6.
No, the line right above it. So
Amount required to maintain existing folks.
yeah. And the total number that's in the draft budget proposes to be 3.9, that number.
So that would mean the
That
budget.
means the same.
would not be the same.
Just-
So 3.9% remains the same increase.
Mhm.
The total 2025 budget required stays status quo at 21,365.35 because the budget's not changing.
Mhm.
Because you're just taking the 255 payment off of the budget.
just the line for the obligated municipalities will change.
Thank you.
You're satisfied then?
Okay, so
Call a vote.
any other questions on the amendment? Debate, discussion on the amendment? Seeing none, then I'm going to call the vote on the amendment only. All those in favor? Are there any opposed? The amendment is carried. And so now we go back to the full motion as amended. Would we, the original mover, Jim, would you like hit red?
Nope, I'm happy.
Okay. Any discussion on the full motion now that it has been amended, Marcus?
I think this is a very reasonable budget. I think if 3% annualized CPI is used as a baseline reference for this, then to come in at 3.9 is a reasonable number, considering that it continues the momentum that we've done, even though it's not technically adding FTEs. I think that if we're moving ahead as a living wage employer, then we should expect that there should be something slightly more than CPI, notwithstanding that that's not necessarily what's reflected in this budget, but philosophical. I think the other thing that we should acknowledge, though, is that before this amendment passed, a 3.9% increase was a 7.8% increase on the municipalities, right? Because the province is fully funding their share. It's a double the increase on municipalities. I really think we should, talk, and I'm sure we will talk with Alpha about our other public health agency partners and about are others seeing the same thing. And I hope this is the time to put that in front of the province again and say, your full restoration of funding results in a double the increase, almost, it'll be slightly less now, on the funding municipalities, just without adding any staff at all. So I think that's an important thing, but a 1% increase in provincial funding is a functionally a 2% decrease in funding is what it actually is. Right? And that's not okay. So I fully support passing this budget. It does, as Cynthia said, maintain momentum on the things that this board has said we want to do, and I think we should continue that momentum. But equally, this is the sort of thing where the premier and the province stands up and says, we haven't raised taxes on anybody. Well, yes, you have. Right here, you're raising taxes on people. If this board decides we're going to continue to deliver the services that our residents need, and we are raising taxes on them to do it. And he gets to skate on it, and that's not okay. So I would just suggest that as part of passing this budget, I would hope that our director and our chair and Alpha member would bring that message as strongly as possible to Alpha, that this is not okay. This is literally the province passing the buck on public health and taxes onto public health and municipalities to continue delivering the level of service that Ontarians need.
Mandate us to. Cynthia.
I just want to make one final comment. So I appreciate those comments, Marcus. I just want to clarify the municipal increase. So it's 3.9 overall. It's 8.8, not 7.8. I think you said 7.8. I'm talking about the original budget. I'm just talking about the original budget. If that's what you were referencing. Just because I just want to be sure that everybody knows the percentage. And then the second thing I'll just say is that, I think this board has been so steadfast in its commitment for public health. Mark just reiterated that. I want to acknowledge that there's an entire group of staff that helped build this budget. And so just kudos to every director in this room, every manager that was involved, and every staff member involved in creating it. It's deeply appreciated.
I apologize for that.
Had to remember.
Since Marcus made a comment, I don't want to rebut it. I just would say, well, I appreciate the budget. I actually think it's too low because, and I'm not talking about the levy, I'm talking about the budget. Because if you take the number of 3%, which I didn't take, Monica, I took 2.5%, and you look at the population growth in our area at slightly over 2%, we in fact are asked, if we're going to serve the people of this area, we have to have a 4.5% increase in cost and a 3.9% increase in revenue. The budget's passed, I'm not going to argue it, And I would also say the other reason I will not argue it, other than I don't want to really tick off the chair any more than I already have, and I can tell by the way she's
Glaring
smiling,
at you.
is that I have a lot of faith that as Cynthia told us, both in the pre-session and in here, that staff actually went through here and said, this is the budget we need. And I think we were very clear as a board to Cynthia say, bring back the budget you need, not the budget you want, the budget you need. And so I'm taking this as, this is what you need. So having said that, I'll shut up about it. I won't complain anymore about the budget. But I do think that if we don't keep in the back of our mind that if we're not keeping up with inflation and if we're not keeping up with the growth in population, we are in fact going backwards.
Right. David Warden has requested a recorded vote. So I will now pass it to
I will call on the members according to their last name. Catherine Agar,
Yay.
Jack Cookit,
Yes.
Jim Herbert,
Yes.
Grant Jones,
Yes.
Bernie Martin,
yes.
David Mayberry,
Yes.
Stephen Molnar,
Yes.
Mark Peterson,
Yes.
Joe Preston sends his regrets. Lee Rowden,
Yes.
Marcus Ryan,
Yes.
David Scheinlein sends his regrets. David Warden,
Yes.
motion is passed unanimously.
Thank you. Before we move on to the next item on the agenda, I also want to extend my thanks. My thanks to staff for putting together a well thought through budget and for your leadership in bringing that to us today. Thank you so much. I also want to thank the board for working together to find the best way to fund the public health needs in our community while also being responsible to our residents.
Okay.
Moving on to the next item, one final resolution to approve the CEO's report. And so the resolution will be that the Board of Health for the Southwestern Public Health accept the CEO's report for November 28th, 2024. Do I have a mover? David Mayberry. Do I have a seconder? Mark Peterson. Any discussion? Stephen.
Supportive of the resolution, notifying the chair that if and when we enter into executive closed session, I'll be rising and leaving the meeting.
Thank you for that.
In case you're looking for me. And no, just time management at this end. Thanks to the chair and everyone, and I probably won't see you till the new year. So season's greetings and Merry Christmas to all.
Same to you, bud.
Thank you. Any other discussion on the motion? I'll call the vote. All those in favor? Any opposed? That motion is carried. Thank you very much for your work on this. And now we move on to item, there is any new business?
Not anymore.
Thank you. Item 7.0, closed session. The resolution that the Board of Health moves to closed session in order to consider one or more of the following concerns as outlined in the Municipal Act. A mover? Grant, seconded by Mark Peterson. Any discussion? I'll call the vote. All those in favor? Any opposed? That motion is carried and we are in closed. Resolution is that the Board of Health rise with a report. Do I have a mover? David, seconded by Jim. Any discussion on that? All those in favor? Any opposed? That motion is carried. And then to follow up, that the Board of Health for Southwestern Public Health accept the Chief Executive Officer's report for November 28th, 2024. A mover? Jim, seconded by Marcus. Any discussion? All those in favor? Any opposed? That motion is carried. Any parting words before we adjourn? Our next meeting is Thursday, January 23rd, noon for orientation, 1 o'clock, and we'll be back here at the St.
Merry
Thomas.
Christmas, Happy New Year.
Just a second, do you have a comment before we adjourn?
I do, Chair.
Yep,
Would this
you like-
be appropriate?
it would be.
Thank you. I wanted to thank you for hurting us cats collectively. While I think we passed a good budget, I think we made it difficult on ourselves. And I want to thank you for making it less difficult on us.
So if you want to say nice things about the chair, you can say that at any point.
Well, apparently not.
All right, a motion to adjourn, a mover, Grant, seconded by Jim. Thank you. Any discussion? I'll call the vote. All those in favor? We are adjourned.
Merry Christmas, everybody.
Patience, Jeff.
Merry Christmas.